Welcome everybody. My name is Bill Cope. I work at the University of Illinois and I've been involved in this conference since it began a number of years ago. And also I'd like to introduce Tamsin Gilbert, who's been working on the program and been in contact with a lot of you along the way as well. So what I'd like to do, this morning it is here, but it'll be this evening where you are, I guess, and we're all in these different time zones around the world. I'd like to introduce Laurie Thicke, who is the founder and president of Translators Without Borders, which is based in the US. And what we're going to do is a nice thing that we couldn't normally do in a Zoom, in a regular plenary format, but we can on Zoom, is we're going to have Laurie's presentation, a plenary presentation, in the form of a kind of a dialogue, a question and answer. And she suggested a number of questions already, and we've worked over them a bit, and we're going to kick off that way. And hopefully towards the end of the session, we've got about 30 minutes. We can be a bit rubbery with that time, but we try not to make it too long because, you know, with recordings and stuff, people's capacity to watch these things is sort of contracting with time. But towards the end, we'll open up the questions to other folks who are here in the group as well. So anyhow, welcome everybody and thank you very much for being here. So, Translators Without Borders, what's language got to do with it, Laurie?
Thank you for asking that question, which I suggested you ask because it is so important. And that's why I'm really pleased that you invited me to this forum, because it's a different place where I get to speak about language, because it is so important. If you think about it, people fight wars and will die for their language. We know how important language is to us on a personal basis. But do we understand how important language is when we talk about health and well-being? When we talk about helping people in, whether they're in our country or our countries, as the case may be, or wherever they are in the world, and not just in the developing world, but in the developed world as well. So language is important everywhere. And I'm really pleased that you're going to give me a chance to talk about why it's so important for health and well-being.
So look, on exactly that, you know, it's a bit of a kind of a surprise for someone to say that language is the most important thing about health and well-being. I would have thought it might have been our bodies or something else. Tell me how language is important, and you know, if no one's talking about it as important, why aren't they?
Yeah, it absolutely is the most important thing in health and well-being that we are not talking about, we're not thinking about, and it's not on our radar. If you think about how we ensure health and well-being of ourselves and our families, it's through information. Right. And language is the critical part to that isn't on the radar, because we all mostly tend to be in our language bubbles. So we're thinking of who we relate to and they're all in our language, and we're not seeing how a message is getting through to people who don't speak our language, whatever language we're communicating in, and don't speak it on a native level. So there are two things here. Do you understand the language, and do you understand it well enough to really get the message, to bring it into your heart? As Nelson Mandela said, if you speak to a man in a language he knows, it goes to his head. But if you speak to a man in his language, it goes to his heart. And a little bit later, when I talk about Ebola and COVID and those kinds of things, we need to not just communicate to people's heads, but we need to communicate to their hearts. If we want to change behaviors and in a very big sense, protect society.
So tell us a little bit about the work that you do with in Translators Without Borders, and how does it bring language into the center? What does it do in terms of addressing these issues?
If I tell you how I started Translators Without Borders, you can also see maybe the transition or the awareness that changed the focus of the organization. Translators Without Borders today is a very big organization with another president, with a big team that runs it. But when I started it in 1993, it was a chance encounter with Doctors Without Borders. I'm a Canadian, I live in Paris, and I have a translation company. they had come to me for a translation, a paid translation, and they said, how much would it cost? And I had always meant to volunteer, but I was always too busy. So I thought maybe this is kind of like a volunteering or a helping sort of opportunity. So I turned it on their head. If I don't charge you for this translation, what can you do with the money? So Translators, and Doctors Without Borders, Médecins Sans Frontières, said that they could use that money in the field, which was the right answer. And so Translators Without Borders started helping nonprofits communicate more. But who are they communicating to? They were communicating to their donors and to the people they were training, to their staff and to their volunteers. Then Haiti happened. The earthquake devastated Haiti. So I had this infrastructure that was supporting the nonprofits who were in the field with translation between the rescue workers and the different nonprofits. And we realized that the people themselves who were the most vulnerable weren't understanding the messages. The messages, even when they were delivered in French, was still the wrong language. They're speaking Haitian Creole. I don't know if you remember, but at the time there were situations where silica gel had been wrapped and had been included in their food packages. On the outside it said don't eat, in the wrong language. There were some problems with that. People weren't understanding how to protect themselves, how not to get cholera. When that happened, I thought, we've been focusing on European languages and helping nonprofits in that way, but reaching the vulnerable people, that's where the disconnect is. That's where nonprofits are not doing a good job of reaching people, especially when we talk about health and rescue and crisis relief. There are issues of information. Like in these situations, the information is the aid. That I still couldn't believe that it was announced. So I next went to Kenya and kind of a fact-finding tour, because I couldn't believe that translation was that neglected and was that important. I thought, the nonprofits must have this in hand. In a village in Kenya, halfway between Nairobi and Mombasa, I met a village with 35 AIDS orphans. And in that village, there was actually information about AIDS, not to get AIDS. There were posters. There was a manual that was actually locally relevant, but it was in English. I couldn't even speak to those people without a translator. I thought, how in hell are they understanding this information? There was a poster that said, if you can believe it, zip it or use a condom. I thought, how good does your English have to be? Like, really good to understand zip it or use a condom. I thought, that's how we're communicating to help people with the information they need to stay alive. I realized, wow, we have a really big problem. So today, Translators Without Borders is a different organization than when I started it in 1993. It concentrates on supporting nonprofits, but also on helping them raising awareness of how important this is. That if you're not speaking to people in their language, then you're just talking to yourself.
Right. No, of course. No, very, very important. So moving on to, today where we're in this sort of global health crisis of a kind we haven't quite seen before on this scale and in this form, to be quite frank, this COVID-19 crisis. So what kind of a response do you think language can or must or could play as we address this crisis?
It's hugely important. And I think we tend to think of health issues as something that we need to treat with medicine. And as you can see, there are very few treatments today, but what there is information. And that's how we're protecting ourselves. We're protecting ourselves because we know to keep a distance. We know to wear masks, but that's all coming from information. So again, if the information isn't available, Translators Without Borders is being very, very active. There is, I think now 101 languages and 4 million words of COVID information that's being translated on a variety of different media. So you might have a poster, but you might have a video, you might have an audio file, just to make sure that people understand how to protect themselves. And this is not just in the developing world either. In virtually every big city in, say, I'm Canadian, let's say North America, there are pockets of people who don't speak the language, who don't speak English, who or speak a little bit, or whether they're, regardless of what community they're from, they need that information in their language. So Translators Without Borders is very, very active in the COVID epidemic, just like in the Ebola outbreak, which is still continuing today. And Translators Without Borders is still working in the DRC, for example, today with the Ebola epidemic. And that was a super interesting translation problem because people were being informed again in the wrong language, but also people were being told in a foreign language that they maybe just had a few notions of, to change something that was really, really important to them, like washing the bodies of their dead, a huge tradition. So it was actually an emotional issue as well as an understanding issue, telling people to do something to completely change the way they are, to not take care of their sick parent or their sick child in the way that they want to. And a foreign language is never going to reach them in their heart. That's what we found. We did research. We found that most people just absolutely didn't understand what they needed to do to protect themselves. 30% of the people believed during the Ebola crisis, when it was at its peak, 30% of the people believed that saltwater baths would cure it.
Yeah.
As an example.
So tell me, what do you think are the big challenges going forward? What are the lessons you've learned from these experiences, and what can we take from those lessons?
One of the biggest challenges is getting the word out. So that's why today I'm happy I'm in a new group. I'm not just talking to people who are in the translation world. And I think it's really actually important to be in this group with you to help spread the message, because that is where people just aren't getting it. And I think we need to spread the message as widely as we can. So many nonprofits are in the field trying to help people, and just they're talking to themselves because they're only speaking in a European language, which of course is the language of the elite. The vulnerable are not speaking that. So that's one of the main challenges that I've learned. A big lesson that we're facing, and the other big lesson is how much we need technology to scale. It's not just a human-to-human problem. The number of languages and the millions upon millions of people who speak these languages. Hausa, for example, is a language in Nigeria that's spoken by, I think, something like 70 million people. So there's really a lot of people who need to be reached in their own language and not in some foreign language, and we need technology for that. That is a really big issue. Is app developers need to be more aware of the issue of language, just like nonprofits need to be more aware of the issue of language, and educators need to be aware of the issue of language as well. How we reach people, it's all about language.
Okay, I've got another question, but I tell you what I might do is I might hand over to other people who've been putting some questions in the chat box here. Susan, would you like to talk through your question? You were the first one to chip in.
Sure. It wasn't a question really. It's just that it's so much. Even if people are speaking the same language, or you're reading in your native or a language which you've learned, that still doesn't mean that you have the correct level of education to be able to understand what you're reading. And then also the health literacy can be, for very educated people, their level of health literacy can be very low. For example, my father was an engineer. He was highly educated. He had a master's degree, but his level of health literacy was horrible. Like, he didn't really understand his role as a patient and a consumer in today's medical world. And he would read medical information and be like, that's for the doctor to understand. I can't understand that. I'm like, actually, you can if you look this up. And of course, I'm a librarian. I'm a medical librarian. That's what we do. We help translate medical stuff for regular people, in addition to helping the physicians to communicate more clearly with their patients. So there are so many issues about language and in this case, but yeah, so that's all I wanted to say. Thanks.
No, that's a really, really good point that you made, Susan. And Translators Without Borders also has projects going to work on simplified English and simplified French, so that the translations themselves are being simplified upstream before they even start being translated, because it is really important. You're not going to use a technical translation for something that people aren't going to understand. So we have to take it into really basic language. You're absolutely right.
And Louise, you made a very good point there about the issue of marginalised migrants. Just one little example, by the way, from Australia. I'm from Australia originally. I'm working in the US now. That Melbourne had a re-outbreak of COVID, but it was actually primarily amongst communities that were non-English speaking, who didn't have access. And even it wasn't just, Australia has a very good record of doing translations of things, but perhaps Susan's point, if it was printed and written, it might not be in somebody's realm of literacy practices. But anyhow, Louise, the point about migrants, I know you work with issues of migrants in the European context. Tell us what your thoughts are on that front.
Yeah, so I mean, at the moment with COVID-19, so the recommendation from the World Health Organization was to proceed with these translations in many languages, aware that there will be migration populations who will not necessarily understand the even the very basic instructions or be able to actually abide by those instructions. That's obviously another issue. And then obviously that was very interesting when you said that people you're actually simplifying further these instructions. And are these just written instructions? Or are you talking about your translators, your interpreters going into the field and working, perhaps talking about marginalized migrants, but vulnerable members of the population? Are you actually going into in the field to work with these populations?
Yes, yes to all of the above, and I agree with you so much. It is so important. Translators Without Borders has been building capacity a lot with interpreters as well, even though it's spoken and translation should be written. We've been training translators and interpreters in local communities, including in the migrant camps, especially coming in through the Mediterranean, people who are who were arriving on the shores and not understanding whether the people coming towards them are friends or foes. Sometimes they would flee in the boat, back into the boats, not realizing that the message was, come in, change out of your wet clothes. Here's where the buses are and things like that. So we've been training interpreters in those situations, in those camps. Also very, very active with the Rohingya in Cox's Bazar, for example, working with the camps to make sure that people are understanding information that they're being given and what they're supposed to do.
And in addition to that, you're saying that you're training these your translators or interpreters. What is their background? Do they also have a background in sociology or psychology, or what is their first proficiency? Is it translation, interpreting, or is it obviously this requires not just the skills, language skills, but it also requires people skills, knowledge of the field, how to deal with these populations, and as you were saying, they don't know whether you're a friend or foe. So do they actually receive other training in addition to the basic language training?
Well, they are just working as interpreters between, say, a healthcare professional and the migrant, or an administration worker and the migrant. So they're not making decisions themselves. What they are doing, like for example with Rohingya, is they're helping people communicate, but they're also advising on issues. How do you speak to women in this camp and ask them about maybe a sexual violence issue, but using appropriate terminology, using the kinds of words and the kinds of approach. So people are from that community who are being trained up, and they know the traditions, but what they don't know is the technique of translation or interpretation, and that's where also we're working.
Thank you.
Because you're right, it's a very intense cultural issue as well. If you want to find out how something's happened and how to use the right words to elicit the information, if there's been some, for example, sexual violence in the camps.
And I wanted to add one more thing that, Louise, when you were talking, it just reminded me, is that people going along with, if they can't read at all, creating podcasts or other oral kinds of products, literacy products, consumer health products is another way. And then also just visuals, like there are some printed materials that are mostly pictures with very few words. Again, there could be misunderstandings easily. You'd have to be very culturally contextual with that too, or else you'd be offending people without even realizing it.
Yeah, that's very astute. And yes, so a number of different media are being employed as well. So it might be a podcast, it might be something people can access on a smartphone, or a little video with some text below it.
And look, amongst the other folks there, does anybody else have a question? Would you point you'd like to make, or a comment you'd like to add? You can just sort of turn your camera on and wave, or put it in the chat box. But what I might do is, in the meantime, what I might do is kind of ask a final question. But again, you can still jump in if you've got something you'd like to ask. But I think the questions so far have been very, very interesting and elucidating. So the final question is, okay, where do we go beyond this? Which is, what are the implications for these experiences? Where does this take us in this broader domain of health and well-being?
What I would love to see is at next year's conference, all of you who are experts in the field to be thinking how those are integrated, because that's what's not happening today. What's happening is we have the language people over there, we're thinking about language. We have the experts in their domains in health, and how do we bring those together? That would be, and the technologists, because the technology is super, super important. For example, how scalable is it? We do quite a lot of work with Wikipedia, and one article can have 50 million hits in 100 languages, for example. And that's another way to use technology to really reach in that, what do they call it? Well, there's the last mile. This is like the language last mile. If we can just get into people's cell phones where they're getting information today, even the developing world. I bought a smartphone for $35. So you can really, we can do a lot with technology as well as awareness.
Okay, well look, I mean, the only other question that I was going to ask, is the one, and actually Louise touched on this as well, is the whole question of getting valuing bilingual professionals, right, who are not necessarily trained translators, but also who have domain knowledge, right? So, there are these other kind of community, workplace practices which could be used to value language more than it often is.
So, for example, I mean, that's perfect. Someone who has medical training and just doesn't have the information on how to interpret. For example, in Africa, most of the healthcare is being delivered not by nurses, not by doctors, but by community healthcare workers, which is so a huge issue. I mean, we've seen some countries just have so few doctors and nurses, but so they have these community healthcare people who have some knowledge, but yet they're being trained in the wrong language too. So Translators Without Borders, which also does research, has done some research during Ebola, for example. They found out that the community health care workers who are trained in English retained 16% of what they learned. Yet when they were trained in their own language, they retained 90% of what they learned. And that is a real difference. If you, like you said, Bill, taking the medical knowledge, just mixing it with some knowledge of language interpreting into their own language, not into another language, then we've got a really strong healthcare response that can start leveling the playing field.
Yeah, that's tremendously important. So, all right, well, look, thank you everybody for being part of this. Laurie, would you like to just have a few closing words for the folks who are here who are online and the people who are going to be watching this video later? You know, where are we going? Well, generally in this medical crisis now, but where are we going in terms of this big issue of language in health and well-being?
For me, it's just as I last said, it's an issue of leveling the playing field. We're living in the information age, and we forget that all the information we have access to, literally all of human knowledge, we can access, but only because it's in our language. So how do we get, and I think that's the big challenge of this age. This is the information age. Okay, let's move with it, and let's make information democratically available and take it out of these silos. I mean, it's so elitist to have these silos of knowledge by language. And if we want a truly egalitarian society, we need to give everybody access to the same information that we have.
Well, what a great way to end the conversation. So thank you very much for that, Laurie. And thank you for being with us, and thank you for everybody who joined us in this session.